Hello and welcome. My name is Michael Chayton. I'm a scientist at the Center for Addiction and Mental Health and an associate professor in the School of Public Health at the University of Toronto in epidemiology. And I'm really excited to have you here today to present some of our initial findings from this project on access to mental health and substance use care for gender and sexually diverse youth during the COVID-19 pandemic. Starting off, I'd just like to acknowledge that we are working on the traditional land in Toronto of the Huron-Wendat, the Seneca and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. This project funded by CIHR, I think, is a really important one. And as you'll see today, that the stress of the pandemic has exacerbated some of the existing disparities in access to care, and particularly for mental health and substance use that gender and sexually diverse youth face. And we're hoping that this project is a way of shedding some light on the barriers and also a way of being able to find some solutions to create new and novel ways of working that reduce those barriers and increase access to care, again, particularly for gender and sexually diverse youth. Today we have speaking three people: Rebecca Billington, who is a social work student from the University of Toronto, Iman Musani, who is a student in epidemiology doing a master's of public health also at the University of Toronto, and Mahalia Dixon, who is here as a representative from the Youth Engagement Initiative at CAMH, who has been a key part of the project so far. And with that, I would like to turn it over to Iman. Thank you.
Thank you. And I will be starting us off today with just talking about some of the characteristics of youth who may be experiencing barriers to access. And I'll be presenting a preliminary analysis of an ongoing survey that we're working on. So just to start off with a little bit of context, the mental health impacts of COVID have been widespread, as we know, and emerging research has suggested that youth from gender and sexual minority groups especially have been vulnerable to experiencing many of these mental health related harms. This is potentially due to social isolation, unsafe or unwelcoming home environments, and of course, a lack of access to appropriate mental health and addiction supports. And despite the swift emergence of telehealth services that we've all seen, research from across North America suggests that many of these new interventions may not be serving the youth that they seek to, and that issues of access remain highly prevalent in this population. So with that said, the purpose of this analysis was to better understand some of the characteristics of gender and sexually diverse youth who are facing barriers to accessing mental health and addiction support in the context of the COVID-19 pandemic. And the goal is that as we understand more of who is experiencing barriers, and then later more about the nature of these associations and the nature of the barriers themselves, we can work more effectively towards addressing gaps in services that we're seeing. Now, onto how we completed this analysis. The data we used is from the ongoing 2S LGBTQI+ Commercial Tobacco Project Screening Questionnaire. And this is a survey that has been administered virtually to youth in Ontario and Quebec who identify as being gender or sexually diverse. And participants for the survey have been recruited through paid ads on Facebook, Instagram, Grindr, and through networks of our youth advisory group and working group members. To analyze the data, we completed bivariate comparisons between barriers to access and a whole host of other variables that we'll hear more about in a little while, including demographic, mental health, and substance variables. So when we talk about this outcome of barriers to access, we have defined it into three separate categories. The first being individuals who sought mental health or addiction support since March 2020 and faced barriers to accessing that support. The second are individuals who sought support since March 2020 and were able to access that support without barriers. And then the third includes individuals who did not seek any mental health or addiction support in the past year. And when we look at our sample, we can see that first of all, in total, 80% of the population in the sample stated that they sought some sort of mental health or addiction support in the past year. And alarmingly, 60%, almost 60% of these individuals were unable to access the help that they were seeking due to some sort of barrier. Now, looking a little more into our sample, we'll start with some demographics. We have 886 respondents to date here, and the average age of the sample is 21.8 years, but we have participants ranging from ages 16 to 29. And then the sample currently is 67% white. Looking at where our participants live, over 70% of them reside in large urban centers, and over 85% of individuals have lived in Canada for their entire lives. In terms of education, we have respondents ranging anywhere from less than high school education to university or higher, with about 1/3 of the sample reporting having a university education or higher. And then in terms of household income, we have respondents across all of the categories that we have identified, and there's a substantial representation from respondents in all these income brackets. So now we have sexual orientation and current gender identity. When we look at sexual orientation, we can see that the most commonly endorsed sexual orientation in this sample was individuals stating that they are bisexual, but as you can see, there is quite a diversity. In terms of gender identity, almost half of the sample is made up of self-reported women, and then we have men right after that, which is around 20%. And then when we look at these demographics as they relate to barriers to access, we found that 5 of our demographic variables were significantly associated with the experience of barriers to access. So 2 of them you see on the screen here, and I'll explain those shortly, but education, income. In addition, we saw age, and then current sexual orientation and current gender identity as well. So we'll start here with education and income. Just to kind of orient everyone to the graph, the length of the bars here represent the proportion of individuals who sought some kind of mental health or addiction support. And then the gray portion of the bar represents individuals who face barriers to access, and the pink is individuals who are able to access support without barriers. And we can see very clearly that the proportion of individuals who experience barriers to access was much more than those who were able to access. And this is something to kind of keep in mind throughout the presentation, because we'll see this repeating. Now, when we look at current sexual orientation and current gender identity, we see a similar trend with many people facing barriers to access. I just want to draw your attention to one other thing here, though, and that is those individuals who exhibited lower rates of help seeking overall. So when we look at current sexual orientation, we see that those individuals who identified as not sure or questioning their sexual orientation, as well as those who identified as being gay, all exhibited lower help seeking than the other categories in this variable. And then similarly, those individuals who identified as being men also displayed lower help seeking overall. Now on to our mental health variables. So 39% of respondents to the survey had a diagnosed mental illness in their lifetime. And the most common mental health diagnoses were anxiety, depression, PTSD, ADHD, and anorexia or bulimia. And then 65% experienced some form of suicidal ideation over the past year, which again just reinforces the necessity of understanding what these youth are going through, because clearly they are struggling at this point. Okay, so once again, I'll just orient you to the slides. So when we look at how these mental health variables relate to the experience of barriers to access, we can look at this table on the right here. In the second column, you can see the proportion of individuals that sought help, and those percentages are extremely high. So it's not that youth are not reaching out for support, and that's important to note as well. So for most of these categories, the percentages of individuals who reached out for some kind of support was above 90%. But then when we look at the third category, or the third column in the table, we can see that the proportion of those who are able to access help without facing barriers is extremely low in comparison. And we can see that also visually represented in the graph on the left. And these mental health variables were all significantly associated with the experience of barriers to access. Now, lastly, we looked at substance use. So regarding legal substances, 57% of respondents smoked cigarettes in the past year, 86% drank alcohol, 66% used cannabis, and 48% used e-cigarettes. And then 30% of respondents reported using at least one illicit substance in the past year. And as we'll see on the next slide, psychedelic use, tranquilizers or benzodiazepines, and fentanyl use were significantly associated with the experience of barriers to access. So here we see similar proportions or similar breakdowns of proportions as we have been with mental health and demographic variables. A couple of things to note here. One, you'll see that in terms of help seeking, the proportions overall are a little bit lower than we saw in the mental health portion. And specifically, those individuals who reported smoking daily and those who use fentanyl at all reported much lower proportions of seeking help overall. So that's an important consideration as we move forward. But again, a proportion of individuals who are able to access help without facing barriers is very low across categories. And all of these substance-related variables, except for the frequency of cannabis use, were all also significantly associated with barriers to access. So this slide is a summary of all the variables that we found to be significantly associated with the experience of barriers to access. And we touched on most of these. There are some additional mental health diagnoses that we weren't able to touch on, but they're all listed here. And this is a lot. So the next question we ask ourselves is, what do these findings mean and where do we go from here? Well, we saw from the survey that there is an alarmingly high percentage of youth from gender and sexual minority groups who are experiencing mental health related challenges. And that was especially demonstrated through the high rate of suicidal ideation in the past year. And we also saw that most of the respondents to our survey wanted to access the support. 80% reported that they wanted to access some mental health or addiction support, but only a quarter of those participants were able to access it without facing barriers. So the analysis that we just completed here was exploratory in nature, and it suggests that there are several demographic, mental health, and substance-related factors that might be associated with the experience of barriers to access. And this is important because these might be valuable population characteristics to consider as we improve current services and develop future services. Importantly, this analysis showed us that there are these associations, which provides a foundation for further study and really allows us to develop our understanding of what these associations look like, the nature of them, as well as the nature of the barriers themselves, which we weren't able to look at here. As we continue this work, a big part of addressing the needs of youth from gender and sexual minority groups is to keep youth involved at each stage of the process and to put their perspectives at the forefront. And later you'll hear more from Mahalia on how exactly we're doing that as part of this project. And another important aspect to strengthening our understanding of how to move forward is to examine where we are now in terms of the resources that are already available, some of their strengths, and of course, where the gaps are so that we can move past those gaps. And so with that, I will pass it over to Rebecca to walk you through the environmental scan component of the project.
Hi, everyone. Thanks so much, Aman. As has been shared, the literature does acknowledge that there are disparities and barriers that have been exacerbated during COVID-19. And in order for us to address this, we really do need to take a deeper look at what the landscape of services for youth looks like. And that's where the environmental scan came in. So now we'll take a deeper look at what we were looking at through this process. So as you can see on the screen here, we use several inclusion criteria, with the primary one being that every single service had to offer exclusive programming for gender and sexually diverse individuals. We made this distinction to recognize that services are offered on a continuum of cultural inclusivity. Some do so by offering welcoming environments, perhaps through things like having a flag in the waiting room or participating in pride events, while others offer more affirming services where staff might receive specific training on how to incorporate themes of gender and sexuality into their practices. Even with affirmative services, however, there does remain some limitations around differences of staff training and experiences, as well as risk or perception of risk by service users that their identities will be stigmatized either by staff or other participants in places like wait rooms or group settings. Therefore, the literature has identified that exclusive spaces are best fit to meet the needs of this population. So we really wanted to know more about what this looks like in Ontario context. To be included out as well, we were looking at programs that offered services to youth 16 to 29, either exclusively or as part of the adult population. Services focusing on mental health and substance use specifically. Services offering either direct interventions like counseling or as an entry point or exposure to the treatment system through things like peer support groups or referral spaces. And we did not include any individual private practitioners. However, we did include groups of practitioners or public providers. So on this screen, you can see how we found our services, and that was through several different sources, including Ontario-based resource databases like Youthline, Rainbow Health Ontario, resource guides, both regional and issue-specific. And we also looked at a Facebook group called the Toronto 2S LGBTQ Service Providers Network, just to find out a little bit more about what has been shared through more informal channels. Each website and social media page was manually scanned for inclusion criteria, and this was done between November 2020 and February 2021. So taking a look here, we tried to approach the scan from the perspective of an individual youth, where depending on their mental health symptoms and the severity of those symptoms, as well as their own physical and social locations, we wanted to know more about what services would be accessible to them. And from this, several themes came up, including how services are distributed across the province, the types of services that are being offered, the ways that services are delivered or adapted during the pandemic, and individual program criteria around different social locations. So now we're going to take a look at each one of these themes individually. Getting us started with the first theme of distribution of services, a total of 113 organizations were identified. The vast majority were offered in a community setting, where only 5 took place in a hospital setting, and there was only 1 residential treatment center for substance use identified. We used LIN regions to group locations due to their role in healthcare funding distribution, their ability to capture distinct population centers, and the availability of region-specific Canadian census information that just allows us to better contextualize the numbers. So truthfully, there is a perception out there that services for gender and sexually diverse individuals tend to be a bit centralized to Toronto. But the question has always been, is this just proportional to the immense population that the city has? And this scan really has identified that both population-wise, in second place at 3.7 programs per 100,000 people, and geographically at by far first place with 23.4 programs per 100 square kilometers, there seems to be a bit of a concentration of services to the Toronto region. It's also worth noting that most province-wide programs like Youthline, Project Affirm, CAMH, they're all stationed in Toronto, and in regions with smaller populations, these province-wide services tend to make up the majority of available programming in the regions, which really does offer support to the virtual format of program delivery, but also speaks to some further questions we might have around how well known are these services in these areas, how well utilized, and how well positioned are they to meet those region-specific needs. So looking at types of services, most services were either free or included some free aspects, which actually makes sense because we did not include those individual private practitioners. And as you can see here, we have peer support groups as the most frequently available form of support at 60 identified services. Peer support groups, as well as other services where people might gain entry into the mental health system, either by being introduced to mental health topics, treatment options, or referrals, consisted of 146 services, and that's compared to only 49 treatment options. As you can see in the bottom chart, most services that did offer addiction care did so in conjunction with mental health treatment, which is actually a good sign and really is the gold standard for addiction care in a lot of ways due to the prevalence of concurrent disorders. However, one limitation of the information that we collected is that we weren't able to identify which ones endorsed an abstinence versus a harm reduction model, which is an important consideration when we're looking at low barrier programming for youth. It is also important to note that only one addiction-specific organization was identified, and this was 12-step programming in terms of just focusing on addiction, no mental health components really. And the limitation with 12-step is that it does focus on spirituality and abstinence as its core, which may be ostracizing to some youth. Therefore, the lack of addiction-specific organizations may pose as a barrier for those without a concurrent mental health concern or for those that are experiencing stigma-related perceptions of their mental health. So moving along now to methods of delivery during the pandemic, you will see on the screen a word cloud of different adaptations used by service providers, where the bigger the word, the more frequently noted the adaptation. Most services have moved online and are most frequently offered via Zoom, but other platforms like Discord, Skype, WebEx, Olark, Talk, Google Meet were also identified. Social media sites like Facebook and Instagram are being used to maintain contact with participants and community members right now through doing things like sharing resources, interactive activities, hosting live events, and just using it to chat with community members that are seeking support. Several organizations are now actually offering check-in programs where a staff once a week will reach out to people facing isolation via email, text, social media, just to maintain that contact. And other creative ways that people are adapting are by offering socially distanced walks to participants or offering some type of monthly kit for online group participation. Interestingly, several programs have also been able to increase their service area due to the shift online, where they're now offering province-wide or nationwide services, and others are just better able to serve those living on the borders of their service area. Several limitations on that note have also been identified. 13 organizations had to cancel all or part of their services. Walk-in and drop-in services have been particularly challenged to adapt due to their open door model. And for those that are still able to offer in-person services, many have had to shift to an appointment or time-limited interaction. And this can impact their ability to create that safety and that relationship with the youth in order to help them engage further with the social service system. Some counseling programs have also had to stop accepting new participants, just related to increased need of their current clients, as well as just resource constraints. And another barrier that came up was a little bit of silence online for how programs have been adapted during COVID-19. And this can be particularly impactful for people who have accessibility needs. So a final theme that we took a look at is program criteria. So as mentioned, every single program that we looked at did offer services to gender and or sexually diverse individuals, but many also had additional criteria recognizing the unique experiences within social locations. Gender criteria was most commonly noted, where 6 programs were only for women, 16 for men, and 39 for transgender and gender diverse individuals. Cultural, religious, and ethnicity-related criteria was also noted, commonly for Indigenous participants, Black, Caribbean, African participants, newcomers to Canada, and even less frequently for other social locations within this criteria. Skipping down the chart a little bit, you'll see post-secondary enrollment was also noted, and this was typically the main source of services targeting young adults. And a few other criteria were also noted, as you can see on the slide here. And just to note, these numbers do not add up to 113, and that is because many services did offer criteria that were multiple, intersecting for different social locations, further recognizing diversity of experiences. So in addition, just a couple notes here, we switched gears a little bit partway through to also take a look at different accessibility of mental health services for substance use and mental health programming for gender and sexually diverse individuals within a hospital setting Canada-wide. And we did that partly because of our affiliation with CAMH. We wanted to know what other programs in Canada were offering similar services to what we were doing. And on the left here, you can see that 12 programs in total were identified as a hospital-based program in Canada. 6 provinces or territories were identified as hosting these programs, and 5 of them were actually located in Ontario alone. At the top here, you can also see a word cloud of noted pandemic-related adaptations. Again, a lot of programs are going virtual, and perhaps because many of these programs offer mental health services concurrently with medical services, many continue to have in-person capacity with the limitation of not having supports allowed in with the youth, and also only allowing in-person services to those most desperately in need. A quick note about program criteria for hospital-based services. 8 of the programs were for trans and gender diverse individuals only, and this was typically with the added criteria of gender dysphoria. And as the mental health services were offered usually in partnership with medical transition services, these would not necessarily be accessible to all trans and gender diverse youth. And it really does speak to how hospital-based services in many regions, although not all, do have that element of medicalization of trans and gender diverse experiences. So a final prong of our scan here included conversations with 7 service providers and researchers. A few things came up around barriers and advantages of adaptations, and just briefly, a lack of flexibility with funding requirements to adapt during the pandemic was a recurring barrier, particularly for those smaller agencies that might have been offering those pockets of support or, in the form of a drop-in or maybe a food cupboard program. Accessibility of technology and harm reduction supplies was also noted as a limitation. And related to all of this, loneliness has been a particularly challenging experience for many, especially those without those natural support system and now have less access to that community space. Some advantages of adaptations have also been noted, however, including with everything going online, some people are better able to access services outside of their community, and therefore they actually feel safer to do so because of that element of confidentiality. Youth are also already engaged online, and for many, it actually feels like a familiar and comfortable way to interact. And they also have more access to self-guided mental health resources, which again can feel more comfortable for some. Expansion of service areas has definitely been a benefit. And finally, some of the creative solutions that agencies have been using to address isolation, like those check-in programs, now more access to text-based services, and just having that increased presence on social media have all been beneficial. So thank you for taking this time to listen to my spiel on our environmental scan. On that note, I am going to pass the mic over to Michaelia here to share a little bit more about how we are moving our research into community-based action.
Awesome. Thanks so much, Rebecca and Iman. I really appreciate everything that you folks have put out. I know for myself, like even as many times I'll hear this data be presented back, I always am sort of amazed by it. And I think that one of the difficult or tricky parts is that, or I guess positive parts on the same length, is that it is very much representative of the realities of many young people, especially young people coming from this community. Now, with that in mind, you can sort of get into talking about how it really links with the realities of community and what it is exactly that folks are experiencing. One of the unique pieces about Smash COVID is how it is not only gathering this information on these barriers and just recognizing that it's happening, but it's also aiming to be responsive to this increasing community need. This isn't data for the sake of data or research for the sake of research. It's really, the whole point of this project is really to leverage this information, leverage what community knows to be true, and work with that to better support and work with community in the long term. Changing? Okay, cool. Yeah. So I think one of the main purposes of this project, of course, is to address barriers that exist for gender and sexually diverse young folks seeking affirming mental health and substance use related services. Of course, like I said, we're not only recognizing current and ongoing service gaps, but we're seeking to rectify this through a proactive approach to care. We're sort of pivoting away from looking largely reactive system structures and understanding that yes, access to affirming safer communal spaces is harm reduction and will inevitably have long-term positive impacts on the community. How this will be done, of course, is really going to be entirely informed by youth and by community. Part of my role, of course, as a youth engagement facilitator is to sort of bring some of that voice onto the project, as well as another youth advisor from our team who's also joined the Smash COVID team as well. But going beyond like our initial smaller team, we also are aiming to recruit a larger number of folks, as I will get into in a second as well. One of the unique natures of this program, of course, is like that large focus on co-design, not really so much on the end stage consult and more so understanding that in order for this to be effective, meaningful, and supportive, we do need to have youth involvement and specific youth involvement, diverse youth involvement from the get-go. And youth are to be treated and recognized as project partners with expertise in the field. Whether it be lived expertise, worked expertise, whatever it is, we do have expertise and that is to be honored. One of the first pieces of this project that I really want to highlight here as well is how we aim to take on like a non-hierarchical approach to youth engagement, which is kind of what I tried to get to with like this little pyramid X sort of structure here. So we recognize that all members of this team do bring their own expertise in varying fields. And yes, this absolutely includes the young folks that we're aiming to engage with. Instead of taking that hierarchical approach, we are working to communicate collaboratively, to work collaboratively as a larger team. We also recognize that, the need, I guess, for young adult voice in not only the final output, but also through the design of Smash COVID. So that's why, young folks, including myself and the other advisor on our team, have been involved from the early stages. Youth involvement takes tons of varying forms based on, availability, capacity, all that good stuff. So for example, we sit on like project steering teams or design teams. Also part of it is part of the social media and promotion strategy, as well as the facilitation of our actual design and prototyping that we'll also be teasing a little bit in a second too. So overall, youth are to be involved, community is to be involved, all the way from inception to dissemination. Now, part of closing the loop, like everything we've talked about, sounds great, right? It sounds super cool, sounds amazing, but how are we actually going to do it? So this is where we kind of want to close the loop and figure out how it is that we're going to ensure that service providers, agencies, all of those folks will also be able to have access to it, access to this information in order to best support young folks in the long term. So where this actually begins is with multiple prototyping sessions with community members to build an ideal and realistic model for service usage. So on our team, we sort of using the language of a design charrette, which essentially is a short, intense period of design or planning with a collaborative group of young folks. It's sort of a similar concept to a hackathon, if folks are familiar with that language. We're aiming to recruit about 30 young people with diverse lived and living experiences as gender and sexually diverse, as well as experiences of mental health and substance use, who will be our main idea generators in these sessions. And again, all that to make sure that we are best supporting and understanding the needs, the unique needs of the young people who we are aiming to support. Sharing this information with service providers and agencies through knowledge dissemination materials, as well as ongoing supportive relationships, if that's something that is deemed as being helpful or necessary, is also a key piece here as well. We also aim to take back the ideas generated by our soon to be established wonderful group of young people in our first sessions to service providers to get their input on the project's trajectory, as well as if we're missing any pieces from that perspective. Of course, through all pieces of this puzzle, continuous youth and community engagement is key in ensuring that we are on track. Sort of in summary, we know that our approach needs to be accessible. Part of responding to this need is that Smash COVID recognizes that young people are experiencing large barriers to accessing care at this time. The last 40 minutes of our presentation wouldn't be true if, or wouldn't be accurate or needed if people weren't experiencing barriers. Existing service gaps have widened, inequities along with them. And so the project aims to reduce the impact of these barriers by providing participants, meaning those like young people who would be engaged with our design structure and design projects, with honoraria, access to a device, internet, all that good stuff. Because we know that young folks most in need of low barrier services would be unable to provide feedback otherwise. And again, that sort of feeds into our project being relevant. We need this project, and ultimately the tools coming out of it to be relevant to the needs of young people. That's how it's going to be effective. That's how it's going to be meaningful. And that's how it's going to be ultimately successful. This also ties in with engagement and making sure that our project is engaging. Our methods, we hope, fingers crossed, are engaging to the young people we're working with. Something that I didn't mention with design charrettes as well is that we are working with a large design team. I think some folks are also on the call here today, which is great, who is they bring their brilliant expertise in design, visual design, also program design, all that good stuff, who are able to keep things fresh and interesting. And then supportive environments or supportive approaches also ties in well with accessibility. We want this to be a supportive project, a supportive experience, not only for the young people who will ultimately end up using these services or benefiting from them, but also for the young people designed in the design or engaged in the design process. We want to make sure that they are supported throughout. And part of that, of course, is making sure this is as an accessible process as possible. And again, affirming, that's one of our really big words that we really want to hammer home with all of our projects. Knowing that, again, what are these services if they're not affirming? What are we doing if they're not affirming? It's nothing, right? You know, affirming identity, affirming experience, validating expertise or experience not only as expertise, but also like what it took to get there. You know, not just lived experience, but the living experience that folks are going to be sharing with us and using to leverage our projects that will ultimately be able to support a larger group of young people going forward. So yeah, I think going, and with that, I think I'm going to pass it back over to Michael.
Hi, and thank you so much, everyone, for your presentations today. And I think that when we first looked at this data that came out of the survey, it was, I mean, my heart stopped. We expected it to be not look great. Sort of everyone knew that COVID wasn't a good time, but the scale and the extent, and particularly the extent of the barriers faced, the number of people who sought help and were unable to do so, I think is should be I mean, it's something we were aware of, but the scale of it was something that I wasn't aware, and that needs to be much more widely known. If make sure that everyone who presented today is sharing their screen again. I just wanted to if everyone who, or if people in the audience, if they'd like to ask a question, you can do so in the Q&A box. Please type it in, and we will respond. As you're doing so, I'll just wanted to start off with a question to Iman. First, I guess a question of clarification that. When we looked at access to care, that's not specifically access to a particular issue, but could be access to any one of those concerns. Correct? And secondly, I just, you know, those are extremely concerning numbers. And how do they compare with other surveys or data that we have on the effects of COVID or the effects of access to care and help seeking among gender and sexual diversity?
Yeah, so to clarify, yes, this is access to any kinds of services. So although we did split the kind of determinants into mental health and substance use and demographics, it's really any type of service. And then with regards to how this compares to other research that's being done currently, it's pretty in line with what we're seeing. So a lot of the research that I found was saying that youth they want the support. So they are reaching out for help. Help seeking is high kind of across the board. But it's that a lot of the places where they were seeking help prior to the pandemic are not available anymore. Things like school were huge sources of support for these individuals, whether that be through teachers, school counselors, or, you know, just like social supports that are present in that setting. Also, I mentioned briefly about the unsafe and unwelcoming home environments potentially being a contributor to a lot of the mental health challenges being faced by young people during this time. And that also applies to their ability to access support. A lot of young people in gender and sexually diverse identities, they're not able to access supports from their own homes because they potentially out of fear from, you know, their parents hearing them or, you know, just being uncomfortable with having that conversation in the presence of other people. And of course, we know that the in-person connection is very valuable. So despite the fact that youth are always connected to online sources and stuff, the ability to access support is really kind of consistent through the studies that we've seen so far. And their desire to access support is also pretty consistent.
Thanks, Iman. We have a question from Terrence, and I'm going to direct this to Mahalia, but feel free to direct it back as well. So the question is, thanks for sharing the info. What does CAMH plan to do with this? What are the next steps? Yeah, so if you would like to describe a little bit, and I'm happy to expand on that as well.
For sure. Yeah, great question, Terrence. Yeah, because like we were saying, we really want to make sure that we're doing something productive with this information, being able to support young people long-term with this information. So over the next little bit, over the next couple months, we're going to be working with a medium-sized group of young people in those design charrettes to sort of really design what it is that they think ideal service or service usage might look like for them. So it's going to be like a couple of really intense sessions with this medium-sized group of young people to sort of to work with that program design, and then also taking that back to service providers and other folks to continue to rework it, make sure that this is accessible, make sure that this is also going to be ultimately sustainable in the short or medium term as well. So yeah, the next steps are going to be recruiting that group of young people, getting them started, hitting the ground running, and then running those couple sessions, those intensive like design charrette sessions with them. And then from that, based on whatever information they're able to give us, whatever genius they're able to bring to the table, then we're going to sort of work with that and figure out how it is that we can work with CAMH or other service providers that might be identified in that process to make that a reality and figure out how it is that we can best support young people, given that this is the information that this is the information that they've provided us as what they need. And so that's sort of the next steps over the next couple months. And then after that, then we'll sort of see what happens. But yeah, over the next like 3 or so months, that's sort of our next focus after this webinar. Yeah. Did I miss anything, folks?
No, that's excellent. I think the key, one of the keys here is that we're been working closely with Rainbow Services at CAMH as our some primary knowledge users in the CIHR language, and they will be deeply involved in a couple of sessions for the design charrette that they're committed to listening and to participating in those so that we can come out of those hackathon type session with products or changes and services that could be applied for Rainbow services at CAMH. We're working with a host of other organizations, and depending on the identified directions that the youth are going to take for their new adaptations or new ideas, we'll be inviting them to participate as well. We want the products coming out of this to be usable immediately, and so we're getting their input as well into the design. It will also help that those changes become a reality. Again, if you have any questions, please enter them into the chat. I have a question for Rebecca. You looked at the host of services that are being offered, and I was wondering if you had any other sort of insights about sort of more of the adaptations that people have been making, and sort of the feeling of how successful or not successful, or things that they wish they could do that might have come out of your conversations with them so far?
Thanks for that, Michael. So one of the major themes that came out were how there seemed to be a lot of community spaces, a lot of peer support programming, which is so critical when it comes to addressing the social and cultural components and domains of mental health. Just the ability to connect with others that may understand some of the experiences that you have gone through helps depersonalize it. So it's no longer something going on with you individually, but is now more of a systemic experience, and that can be quite empowering for folks to experience. And this, although that is very vital, what we also are recognizing is that having those skills-based services where folks might be able to access affirmative CBT, DBT, other different therapeutic models that are adopted to incorporate those cultural models are just quite a bit less available. And where we are seeing something encouraging during COVID is that with everything moving online, previously services that were, the few services that are offering those exclusive programming are now being offered to a larger service area. So you have people in Northern Ontario, in other provinces even, that could potentially be accessing these more or less pilot projects. And that's really been something wonderful to see. However, of course, we know from in any interaction we've had with, clients, participants, even our own experiences, virtual does not work for all, and it certainly is inaccessible to those without the technology. So definitely we need some problem solving around that I really hope when we connect with the youth during the design charrette that some creative solutions that might not have been considered in the crisis when we initially got into the pandemic might be revealed.
Thank you again. I just wanted to actually at this time acknowledge Luke Gray, who is our amazing project coordinator and really the leader of this. And his work has really made both this webinar and the entire project feasible. So he's here. The mentions that there is a question in the chat. I can't see it. If someone else could bring that up.
Yeah, can you do it?
Here we go.
Thanks for the special mention. Do you got it? You got the question?
Yeah. Do you want to read it out?
Sure. I'm a service provider at a 2S LGBTQ youth organization serving all of Ontario. Are all the results of the environmental scan going to be shared publicly to support the work of organizations like ours? Thank you for the question. Michael, do you want to speak to that?
Yes, we're certainly hoping we will get this report out, and I'm glad that they seem consistent. That we'd really be interested in sharing. Rebecca, do you want to talk a little bit about sort of the next steps and
Sure. Definitely. So we will be releasing a fuller report of the environmental scan results on our website, smashcovid.ca. So just keep an eye out there. And we'll also look into potentially releasing some of the resource databases that were generated from this in terms of source guides, as well as individual organizations that are serving exclusively gender and sexually diverse individuals.
Yeah, thank you so much for that question. That there are a couple of other websites available that do provide links to access to services, but it is always a challenge to be able to do that process of matching, of finding the services that I would be personally interested in, or that speak to me, and curating that is a really ongoing challenge. But I think that one of the pieces that does come out of this for me is that overall the system is lacking in spaces for treatment in particular, and as well that the current environment has really limited access to those peer support groups. And so the combination of those two types of services, I think, serving the needs of more people in a broader way, in more ways, I think is really important. So, and Kelsey asks if anyone's suggestion for adequately and ethically compensating youth consultants during youth engagement work. It's a great question, and I think that in general, you know, the feeling is like anybody who's working on a project, who's doing work, should be compensated. And Mahalia, do you want to speak to this? And I know this is an important thing of the Youth Engagement Initiative in general.
For sure, yeah. I mean, I think, like you were saying, Michael, I think compensation is really key when it comes to this. Like any type of output, you know, deserves to be compensated, whether it be sharing of lived or living experiences, whether it be like actively working on a project or different capacities. Young people always do deserve to be compensated for the same amount of work, same way that we do as staff. It's the same level of effort, and so they absolutely should be compensated for it. So yeah, I think that whenever it comes to like adequately or ethically compensating young folks, I think, you know, like CAMH, for example, like we do have like a honoraria policy that we honor throughout all of like the different youth engagement work that we do. But I also think that when it comes to like adequately and ethically adequate and ethical compensation, that was a lot of words that were hard to say in sequence. But I think that like when in doubt, compensate. That's always my thing. Like when in doubt, just compensate. Offer whatever we can, ideally as much as we can, and making sure that what we are giving out is in fact reflective of you know, all of the work and everything that people are putting into making the project what it is, recognizing that this project, like many other projects that involve youth expertise, genuinely would not work without the input of young people. It's really built on the expertise, built on the backs of these young people who are able to provide this information to us. And without them, this and many other projects like it would not be functional. Which is a huge part of the reason why it is that compensation is so important. Yeah.
Well, thank you, Malia, and thank you all of our presenters, and to Luke, and to all those who took the time to come here and speak today. We are, you know, really hopeful about our ability to try and develop some new interventions or adaptations that can solve some of these issues that have been raised today. We will be posting the recording of this on our website, and if anyone has additional questions or would like to get involved, please contact us. Either look at smashcovid.ca or through at camh.ca. You can find our bios there. So thank you very much, and have a good day.